I commenced my career as a police officer way back in 1960. I worked in the police force for 3 years in Gujarat Police and then switched over my career to industrial security in year 1962. Actually, it so happened that I have been in the habit of going every day for walking for about an hour, and in those days prior to this problem, I used to walk almost about 3 to 3.5 kilometers in 1 hour. In 2007, in the month of April first time, I got the problem of getting a little burning on my center of the chest. While going walking in the evening, I walked hardly 500 meters and I started getting that kind of a feeling. So I was just taking it lightly as if I thought that it must be due to acidity or something like that, which normally everybody thinks. So I thought also that it may be an acidity problem. This went on for almost about a week.
A week later, Mr. Thatte experienced some pain in the shoulder and he immediately went to his family doctor, who recommended him to a cardiologist. The cardiologist took Thatte's ECG and told him that he was suffering from exertion angina and prescribed some medicines. Mr. Thatte took those medicines for about 2 months, and after 2 months, when he felt a little better, he stopped taking those medicines. A week later, on one of his evening walks, Mr. Thatte again experienced pain in the shoulder.
So again I went to the same cardiologist. He said, "Who told you to stop the medicines? You have to take this for the whole life now." And I was completely taken aback. The whole life I have to take the medicines. Then he sent me for scan. He asked me, "You should have the scan because I am doubtful. Well, let us find out what the blocks are." My cardiologist told me that, "Mr. Thatte, you have to go for angiography now." So myself, my son and my wife, we went to that hospital. Angiography was done. And after the angiography was completed, the doctor told me another shocking news that, "Mr. Thatte, you have got 290% blocks on the left artery, 370% blocks on the right artery, and 270% blocks in the center. And so you have to go for triple bypass." The moment he told me triple bypass, first of all, it was a shock to me. Secondly, I have never had any operation on my body, so I was not accepting a body to be cut like that. So I said, "Doctor, can you tell me what are you going to do? Triple bypass, and what will you do?" He said, "We will take one nerve out of your left thigh, another nerve from your right thigh, maybe third nerve we will take from your hand, and then we will put them in. Bypassing the block, we will do the heart operation." I said, "Doctor, can you tell me one thing? What is the guarantee? After this operation, what is the guarantee? How long you think I can live if I am going for this operation?" He said, "No guarantee, not a day's guarantee." I said, "Then why should I go for the operation? If there is no guarantee, why should I go for the operation?" He said, "No, but Mr. Thatte, you are taking a big risk and this and that." I said, "Doctor, even otherwise you are not giving a guarantee for 1 day also, then why should I not take the risk at all?" Because I knew that in my own locality area, one of my friends who had double bypass surgery, he came after operations from hospital to his house and next day he died. So what is the guarantee that bypass operation will give me even 1 day life?
After learning about his heart ailment, his relatives kept insisting that he go for a heart surgery. But Mr. Thatte was not convinced of their advice. His wife and children also persuaded him to not worry about the expenses incurred for a surgery and to go for it. But saving money was not the criteria for him. In India, the average life expectancy of a person is around 65 years, and in his bonus period, Mr. Thatte did not want to subject his body to scars and traumatic surgery. During that period, he was also in a dilemma about the decision he had taken, because the doctors had told him that from now on he will never be able to lead a normal life and anything can happen to him at any point of time. It was troublesome for him as he had no backing from anyone for his decision. Mr. Thatte did extensive study on heart ailment. he read books, journals and articles on this subject. When Mr. Thatte found out about IPC, he immediately fixed an appointment and visited their clinic. After consultations with Dr. Pratiksha, on the following day, he started his treatment at IPC and underwent 35 sessions of the EECP. The non-surgical treatments at IPC includes advanced allopathic medical management based on international guidelines along with US FDA approved, scientifically proven EECP treatment, which opens up the collaterals, that is, the small arteries of the heart. In a bypass surgery, the blockages are not removed, but the blood supply to the heart is increased to grafts taken from the arms or legs of the patient. The same purpose of increasing blood flow to the heart is attained through the treatments at IPC. There is a general belief that open heart surgery is the only and the fastest way to resume one's normal life. But at IPC, the same is achieved through non-surgical cardiac treatment. Mr. Thatte was extremely delighted when he got the approval from Dr. Pratiksha to visit his son in Canada after the treatment. He is now leading a normal life.